Good morning, good morning, good morning, everyone. Welcome to today's third Wednesday Parent Resources Chat. We're excited that you're able to join us again in this ongoing series of interactive webinars to share more about health and wellness in our great state of Mississippi. I'm your host today. My name is Michael Miner, and I'm the Executive Director of Oak Hill Regional Community Development Corporation. Today, I'm representing our Healthy Kids Mississippi initiative, where I serve as the lead. Lottie Miner is our project director. Well, Lottie and I may have something in common. All right. We also greet you on behalf of our board chair, Jennifer Garrett of our Oak Hill Regional CDC. Our monthly series on our third Wednesday Parents Resource Chat we share useful information for our wonderful parents and caregivers all across the state of Mississippi. Today, as usual, we have three topics that we'll cover. We'll begin with the CDC COVID-19 updates. We'll then talk about Plan A's mobile clinic, and we'll close with some health insurance updates. We have some great panelists that's going to share with us today. After I provide our CDC COVID-19 updates, I'll introduce them and we'll be able to field your questions. Now, look, we also want to give a shout out to all you all that are watching us on Facebook and YouTube. I was amazed. We have a great crowd. I don't know. I guess it's because of the weather in our area that some people are indoors. So we're going to do our best today to monitor our chats on Facebook and YouTube to field any questions that you have. We'll also we'll give you a phone number later that you can actually text if you have any questions that you have. And as you know, every Wednesday when we come in, third Wednesday, and we share, it's always great information. And people just, even after it's over with, talk about how much that they learned. All right, so we are getting ready to get this show on the road. So we're gonna begin with our CDC COVID-19 updates. Well, we had planned on having all kinds of JPEGs and pictures and other things, but things are moving so fast. They're constantly updating and making changes. So we're going to share with you three things that you need to do working with us as we move forward in this process. Continue to go to the CDC website where they're sharing information. Those are things that are in general that they have. Also, you may not realize this, the CDC has several Facebook pages, the direct CDC Facebook page, and also they have a COVID-19 page as well. And of course, the final thing, and it's the final thing on it is those major things that we have. We've tried to do the best that we can to share information on our social media posts. If you haven't done it already, why don't you take an opportunity this morning and like our page, Healthy Kids Mississippi. We do our best to provide daily updates on information about Medicaid and the Children's Health Insurance Program and other things that may be useful for you as parents and caregivers. The main thing that we can let you all know is that we're almost to the end of the tunnel. We can see the light at the end of the tunnel, this pandemic. All right, but guess what? We haven't gotten out of the tunnel. So let's still continue to practice safety, wearing our masks. Even with our shots, we still need to wear our masks, and we can all get out of the tunnel. And then we can look back at the tunnel and be excited how we made it through. But let's make sure we don't let the light blind us, okay? But again, remember, keep following all the updates from the CDC and everything else that we have, and we'll be able to make this thing happen. All right? Okay, well, those are updates. And now I'm excited, everybody. I'm excited because we have two wonderful panelists that are going to come and share about a great new initiative that's happening in the Mississippi Delta. All right? Okay, and this is going to be our part with our Plan A mobile clinic. Okay, and we're going to begin, and I'm going to spotlight her first. We're going to begin with Toria Shaw. All right, there we go, spotlight her. Let me give you a few things about her. She's a family nurse practitioner. She's board certified by the American Association of Nurse Practitioners. All right, she has 20 years of healthcare experience in primary care, urgent care, family planning, look at all this stuff, compliance, hospitalist, critical intensive care, and adjunct faculty. All right. She's got a passion for making a difference in the lives of others through providing compassionate care to all. She believes that it is an honor to serve and to improve outcomes by addressing health disparities through access to quality services. Tori is active in the community and committed to partnering and building a relationship within the Mississippi Delta. All right, Toria Shaw. All right, now for our other panelists. Okay, here we go. All right, there we go. She bring the camera up here. I was like, wait a minute now. I can't bring her up here unless I can. All right, there we go. All right. And now our camera's off. Okay, well, this is what we're going to do. We're going to get to this spotlight. Okay. So Miss Juliet, like what, she's from down south. It's like one of them, we try to gig them frogs, see they keep jumping. There we go. All right, we got her. All right. All right, so here we go. All right, before she jumps off again, Juliet Thomas. It's a native of Greenville, Mississippi, right there on the Mississippi River. Now that's not the bridge over the Mississippi right there. That's out of San Francisco. All right, behind her. She's been a community activist for over 20 years. She started when she was about 8 or 9 years old, mostly in the Mississippi Delta. She received a bachelor's and master's from Mississippi Valley State University. Ida Bena, yes, public administration and rural policy and planning. All right, she worked working for U.S. Congressman Benny Thompson, and Delta Health Alliance has given her a strong perspective and insight into the health disparities that persist in the Delta. She has a passion for helping the underserved in her community. She's also a member of the board of trustees of the Mississippi Delta Community College. Ladies and gentlemen, Miss Juliet Thomas. All right, all right, all right. Now, here we go. Let me get these questions going. So this is what I'm gonna do, because I don't want to go back and forth all day long, because my fingers may get tired. So I'm gonna bring both of them up, and we're gonna have all of us on the screen. And for those of y'all on Facebook and YouTube, whoever's talking, you will see us as we move forward. And again, I just want to just thank everyone, or as the young folks say, everyone. I want to thank everyone that is watching us across social media. Let me just give a shout out to the pages that we're on. We have the Hill Hernando Church family, our church's Facebook page, our state convention, Mid-South Churches Cooperative Conference, Facebook page and YouTube page, Healthy Kids, also our national affiliate, the National Faith-Based Mobilization Network, and the Oak Hill Regional Community Development Corporation. So we are just excited, excited about all the different entities. And we have Catch Kids out of Tupelo. We're just excited about everybody who's sharing. I guess they knew that Plan A was going to be on today. So everybody just wanted, wow, let me get on this and make sure that we can share. So, or something, or they didn't have things better to do. I don't know, whatever the case may be, we're just excited about everybody who's watching us live, and everybody's going to watch us as we move forward. So let me bring everybody in. Let me add the spotlight. And I do want to give a shout out to our most capable metrics technology person, our brother Thomas Duke Robinson, who is behind the scenes working with us, and he's making sure to check if there are any questions. And if the lights go out up here, he'll become your host. So we hope this storm will hold out a little while longer. All right, folks. And again, please, y'all know how we do this on the third Wednesdays. Wherever you are, whatever way you're watching us, if you got a question, let us know. And let me give another shout out to our state convention, Mid-South Churches. our Vice President Lodge, Pastor Bernard Montgomery. They have been sharing wonderful information there for us as we move forward. All right, here we go, ladies. Let's get this thing going. I guess we'll begin with Toria, just because in my screen, she's right beside me. All right. Would you just, and look, I want y'all to know that Toria worked hard this morning to make sure that her background was right, the lighting. And I want y'all to know if she ever decides to leave out of medicine, she can become a director, okay, like Regina King. So I just want to let you know for your future plans. All right. Now, look, would you tell us just a little bit about who Plan A is?
Okay. Again, thank you so much for having us, Dr. Miner, and hello to everybody that's watching today. Thank you so much. Plan A, we're a mobile community clinic, and we are bringing health to Mississippi Delta in areas that do not have right now any clinics close to them. And so we're going to rural areas with our mobile clinic directly to those communities. We will be having a focus on preventative health, reproductive services.
All right, okay, we got you. We got you. Hold on, mess up. Look, she's on G and rating for O. All right, so we got a little bit about a Plan A. So those y'all had not learned. So do y'all have a website or anything that they may go to as well, Artoria?
Right, you can follow us on Twitter, Facebook, as well as we have planahealth.org as well.
All right, y'all hear that? And Duke is going to type that in the chat, so we have it later. So that's planahealth.org. You can learn more about them, planahealth.org. All right, I like that idea of being A. A is the first letter in the alphabet. It's the first choice. It didn't say Plan B or C, but Plan A. So that'll tell something about who they are. Okay, and just once again, that's planahealth.org, and you can find out more information about them. Okay, now let's go down here now. You're saying you're down to Delta. So the Delta's a big place. Now, are you in all the counties in the Delta or just some of the counties in the Delta?
Miss Juliet going to tell you guys where we are serving.
Okay, my bad. Miss Juliet, I'm going to call you Sister Bridge, okay? All right. What counties y'all in there down in the Mississippi Delta?
We are serving Washington, Bolivar, LaFleur, Sunflower, and Holmes County. And in those counties, and I know about the Delta is big, and it is, and we're in Washington County, we're going to be in Metcalfe and Winterville and Glen Allen. In Bolivar County, we're going to be in Benoit, Scott, Laymount, and Alligator. In Sunflower
Hey y'all, she said Laymont, you know, some of us call it Lamont, but you know, those down there is Laymont. But keep going there, Miss Julie.
In Sunflower, we're going to be in Sunflower, Mississippi, and Inverness, and also partner with Mississippi Delta Community College County. Since
now I'm going to ask what the service is going to be. So she already told y'all it's going. She said, "Look, now I see why she got that bridge behind her head, because she said she's bridging the gap. Get it? So bridge the gap, bridge behind her." Okay, and getting those things done. So the services are free. Services are free. Now I don't want to put you on the spot now, but now free. Don't you think people gonna be just trying to beat down the door to get to see you because it's free? She's smiling, y'all.
I hope so.
Wow, that's what I wanted to hear.
I hope they will.
All right, so y'all heard that now. Even though it's free and be coming in, they really want to stand up to the task. All right. Okay. I think, Tori, this is going to be your question. Let's walk down some of the services you all offer. And I want to do it in different categories because, man, y'all, it's like a buffet, the type of service y'all have. When you're in the buffet, you know, everything be looking good and whatnot and everything.
That's right. A little bit of everything. Absolutely.
So let me start on your primary care services. Tell a little bit about your primary care service. And then after I got done with this, Miss Bridge, Juliet, I got a question for you that came in from our chat. So I'll come back to you on that. So Tori, tell about your primary care services.
Okay, primary care services, what we're offering is screenings, and we'll be looking at blood pressures. As we know, in Mississippi, we have African Americans that are twice as likely to have a heart attack. And most patients say, you know, when we find them, identify them with a high blood pressure, they say, "Oh, I feel fine." That's why the silent killer because they said I'm doing just great. How is it that my blood pressure is so high? But some of the other things that we'll be doing with primary care is also screening for blood sugars and your cholesterol as well. And then also screening for domestic violence and also suicide screenings and screenings for well, we got screenings a little bit of everything. So I apologize, but I think I've covered all the screening so far.
All right, and well, I'm really interested in the fact that you're doing. I expected you to do the thing along the ABCs, but I was really excited to hear you talking about the one about domestic violence. We know that during this pandemic, because a lot of people have been on lockdown and the stressors that have been happening, that there has been an issue. So my hat's off to you. So that should probably be something unique there in the areas you're serving for having this domestic violence screening.
Absolutely. And you're very right about it. In this COVID, everybody's kind of closed in, the pressures everybody feel from job loss, also from financial to a lot of times people are laid off and lost their health insurance. So this is a critical moment right now that we're in Mississippi as well as the nation.
Okay. All right. And look, I am not as young as I used to be and not as old as I'm going to get. So I'm going to come right back to you just 1 second, Tori, and ask you about some other services. But I do want to come back to Juliet. They have a question here in the chat. They want to know what part of Bolivar County and Sunflower County again. They want to be sure on where you're going to be in Bolivar County and Sunflower County. So if you can just repeat that again, would be most appreciated.
In Bolivar County, we're going to be in Benoit, Scott, Laymount, and Alligator. In Sunflower
County. So now some of y'all may have just missed that last one, Alligator. Yeah, if you go down Route 1, someplace down there, you got to go down to the heart of excuse me, I'm speaking like I'm from Boston. You got to go down the heart of the Delta, those places. All right, so there we go. All right, in the other county, Sunflower.
And in Sunflower County, you have Sunflower, Mississippi, and Inverness, Mississippi.
Okay. Well, it's funny.
But
there's a but.
Yeah, let me say this. These are the ones that we are starting with according to what they needed. But feel free if we have someone who wants to partner with us in another area of the Mississippi Delta, we'll be glad to set up a meeting and talk with you about bringing services to any other cities or towns in the Mississippi Delta.
Wow, partner. Okay, well, hold on 1 second, Tori. She done opened up something now here. I gotta run this rabbit for a minute. So partnering. So you said a partner. So what is involved in partnering with you all in this mobile campaign?
In this, what we're talking about as partners, we're trying to get community leaders, sororities, fraternities, religious leaders, mayors, all those clinics, especially clinics, to partner with us to provide this service so people will feel comfortable when they say Plan A is coming. They'll know it's a good place for people to go and get some health coverage or see someone that can provide services to them. We're talking about partnering with the whole Mississippi Delta, everybody. We want everybody to be our partner. School systems, Head Starts, we want everybody to be our partners.
All right, so I know it's one of our people that works a whole lot with us with Healthy Kids is Sister Ethel Hill down there with the in the Greenville area, and she's very active. I want to make sure to connect you all with some of the ladies, the first ladies and others down in that area. So it sounds like some excitement to get some things going. All right, wonderful. All right, so Tori, now I'm coming back now. I didn't forget about you, but I told you I want to jump on that question so it didn't slip and that thing got there. Okay, so now we talked about the primary care services. Now let's go to the next set. I said you do quite a bit with reproductive healthcare services. Would you shed some light on what some of those services are?
Absolutely. And the reason why we were really targeting this area really hard because it's less than 25% in Mississippi that actually do reproductive health as far as the long-term for women from 3 to 5 years. And so that's why we targeted that. So, but in our reproductive health, we will be looking at breast and cervical screenings, some planning, blood pressure, birth control options, and that is short and long-term birth control options. So your
Okay.
Nexplanon, your injections, we're covering all of that.
Okay, because I keep hearing all the stories that a lot of the women of color, especially Black women, have so much difficulty in pregnancy. And then I caught that, but I've also been hearing that there are issues with postpartum concerns after the baby's born. You all be working with some of those, with some of that as well?
As Juliet stated, we'll be doing a lot of partnership right now at this time. That is not something we'll be targeting, but we really will work with other facilities, other clinics, other hospitals, and other specialties to help in this particular area. And you're right, the African American women are facing a lot of difficulty in childbirth. Women are dying, and then also a high incidence of cervical screenings because they don't have the insurance, also the access to actually get pap smears. So that's one of the things that we're really excited that we'll be bringing to the community.
All right. So what, y'all, I just got to get a hand clap right there, because guess what she just said? She said, well, I hear a whole idea about teamwork, relay, partnership, handing off the baton. As they're seeing those things and working with that in that network, they have people they can connect them with so they can provide those services. I like that. I like that. So when you find out what it is, you got that network and you say, oh, here you go. I got everything lined up. Oh, I just love it. I love it, love it, love it. If more things work like that, boy, this world would be such an awesome place. But anyway, I digress. I digress. We're gonna move on to the next thing here. Now you do quite a bit of testing. So let's talk about some of this HIV testing and counseling. And let me preface this by saying I was shocked a few years ago when I discovered that there's such a high incidence of HIV and AIDS in heterosexual women in the Mississippi Delta. So would you share some light about that particular type of screenings that you have?
Absolutely. Young adults from the age of 20 to 29 account for in Mississippi 40%. Y'all hear me? 40% of new diagnosis of HIV. And this is in Mississippi.
Wow.
So the CDC estimates that 1 in 7 HIV positive individuals do not even know they're actually positive because they haven't been tested. So we do want the community to know that we will be doing HIV testing. It only takes 20 minutes. So please come out and know your status. It's the most important thing. Know your status, and we will be offering that testing. One other thing that we will be doing is providing the HPV vaccine. So please come out and get that. That also deals with our sexual health, as well as we'll be doing plenty of education for men and women. So please make sure you come by.
All right, y'all heard that, but the young age bracket is going in. And look, we know that a lot of people have kind of taken the HIV/AIDS, taking the back seat to the COVID-19 pandemic. And because of the medication thing, it's becoming more of a chronic illness. But the idea is that if you don't have the appropriate care, it's not a chronic illness. It can literally be a death sentence. Wouldn't that be correct,
Right. And
Tori?
Dr. Miner, I do want to mention that we will be offering the medication, the PrEP, that helps with the HIV. So that is prevention and it's free of charge as well.
So sound like you got it on both ends so that you can work on the prevention education side, and that people that are diagnosed, you want to work with them on a chronic disease management program.
Okay. On the chronic disease management program, they will be with a partnership with a specialist, but we will be offering a medication called PrEP, and this is to help prevent HIV/AIDS.
Wow, man. I tell you, boy, the more I'm digging in and finding about this plan A, I'm seeing maybe y'all should be A1. You be the first on the A and then on the 1, because y'all, this thing is coming together. All right. Okay. All right. So let's go here on the next round. And I tell you, I had to ask this question like this because Sister Tori, if I hadn't done that, she would have been talking about 40 minutes on everything she's doing. And I didn't want to run out of breath. So I'm just doing it as a break to catch a breath back in between and asking all this stuff. So now, I want a little thing about this comprehensive contraception counseling options. You kind of touched on it, but some of us older people and whatnot, I think we may be a little bit oblivious of what all the new options are, and the idea of this counseling. Is there a continuum of services? Is things lined up? if they're young, and I guess the other thing would be if they're young ladies under 18, is there any type of interaction you have with the parents? So I asked a whole lot. How can you kind of roll with that with us?
Okay. At this time, our target areas are 18 and above.
Okay.
Like Juliet said, we can, if at some point some people in the community ask for us to start seeing teenagers, that's something we'll be willing to partner with and consider and talk through how we can help in that particular age group. But at this time, it'll be 18 and older.
18 over. Okay.
In
All right.
those services.
All right. And I asked that question in particular because of that, because a lot of people are watching us now across social media, and later on be watching this video, and we want to be clear on that. Okay, so everybody is 18 and older, 18 and older. So when the bus comes and you're under that, and you're a teenager or whatever, and trying to go in, this is not going to be for you. That's a conversation you need to have with someone else on that matter. Okay, I just want to be clear. So thank you for that. All right. And again, for those that may have joined us late, we're here talking with Toria Shaw and Juliet Thomas from Plan A Health. And they are really shedding a lot of light on activities and services that are available for select counties in the heart of the Mississippi Delta. Again, feel free to ask any questions. For those that's watching us on social media, we do have people that are screening and will be taking your questions. And I have one of them in front of me now that we could be going back and forth. All right. And again, we're going back to Miss Juliet Bridge. Hey, Bridge, I gave a new last name. All right. So just as a reminder, what about the cost associated with these services?
Free.
Okay. All right. So free services. Now, one of the things that we'll look, I put my other hat on here and working with healthy kids, but we do know, and I talked with Toria before and with Maria Morris. I can't never get the name right for their new group. It's always the Mississippi Primary Healthcare Association to me, but she'll type in the chat in a minute and I'll get it right. Community Health Center, folks. All right. Anyway, for those that you all come across, we stand ready at this number behind me to have them give us a call, and we will work with them to get them enrolled in Medicaid, the Children's Health Insurance Program, or Obamacare. And you already doing the other part. You're already connecting them with the federally qualified community health centers. So a lot of people, Juliet and Tori, I'm always amazed at people in Mississippi who don't realize that they could be on insurance today. Literally, they just don't think they qualify. So we stand ready to assist you in getting that done. All right. Okay. Now I gotta get personal here. Oh, here it is. It's not the Mississippi Primary Healthcare Association anymore. It's the Community Health Center Association of Mississippi. The Community Health Center Association of Mississippi. I got it right now. Okay. All right. So now I've heard about Juliet's roots down in Greenville and down in Valley at the Itabena. Matter of fact, Julie, I think my mom was in the first or second class that graduated from Mississippi Valley, something like that. She go way back with that. She still makes homecoming down there in the Delta, the Devils down there. All right. So Toria, I understand that you have some Mississippi connections too. Is that right?
That is right. Mississippi girl, born and raised. My grandparents are from Ware, Mississippi. My family lived and I was born and reared in Hernando, Mississippi. A lot of you might know my uncle Andrew Miller. He's alderman as well as pastor. So I want to give a shout out to him as well. But yeah, Mississippi is my home, my roots. And this is something I'm just really excited about, our new initiative, because I've always been interested in medicine. Even as a child, instead of playing, my mom and dad always said that we could find you at one of the older people's house next door. I'll be helping with medicines, combing hair, cleaning. So this is something that's been with me all my life. And so I'm excited to be in medicine, and I absolutely love what I do.
And she said the Hernando, we love it. That's where our headquarters is for Healthy Kids Mississippi. And that's where I pastor also at the Hill Hernando. I wanted to bring that in. We got two Mississippi connected people. Might well throw me in because I'm from Coldwater, Mississippi. Amen. Amen. I'm going to put that preacher talk in there. That's the best town in Coldwater. It's the only place you can take a hot bath in Coldwater. Yeah. So we all Mississippi folks here. We could have gone to a bunch of other places, but we want to work in the place that we love. That's a good thing. All right. Okay. So we're moving up here. Okay. So now, and I know who will answer this question. This is gonna be crazy, but I gotta ask it. Why do you think so many people of color in the Delta just won't go see a health professional?
I'll take that. Number one, like Juliet said earlier, there are several barriers. Number one, transportation, the money, the lack of insurance, but also there is a lack of knowledge because most people think, if I'm walking around every day, I'm fine. Just like I said with blood pressure. So men is very hard also to get to the doctor. And then women, speaking about women, because I'm very excited about the reproductive health services for women, we wear all types of hat. We take care of everybody and leave self last. And so I think those are the things that really are reasons that we don't go to the doctor. Juliet, you have anything to add?
Just to add a little bit, and you are so correct, you're spot on, Tori. If we, like you said, we're walking around thinking that we're healthy, then we feel that we are. But it comes a trust and confidentiality issue that we have here in the Mississippi Delta. We often have programs that come in and then a year or so later they're gone. So we're here to build trust with people. We're here to educate them on not being afraid of things. And I'm kind of stepping out of what I know, but I know the advances in medicine, provide people to live a long, healthy life, especially if you have contracted HIV or AIDS. Technology and medicines have come a long way, since it first began so many years ago. So, we need to get educated. Therefore, we'll know more about, why we should go to the doctor, why we should do our annual checkups and annual screenings and keep in touch with our blood pressure, glucose, A1C, all of those things.
So who's worse in that? Men or women, or was it about a tie?
Men.
Yeah.
Men.
I really feel
Men.
like men. Absolutely.
What?
Men.
Yes.
Wow.
I totally agree.
Well, it's not even close, huh?
Not even close.
No.
You basically have to drag a man to go to the doctor's office. Literally.
He has to be sick. He has to be sick to go.
Look, that is why the mobile clinic Plan A will be very helpful because we can come to you. The men, you don't have to go anywhere. We drive up and we'll be right in your area and it'll be easy access. And so you can get your screenings done because the most important thing about screenings is if you find something early, we can do something about it. You really don't want all those screenings, like Julia says, like blood sugar and also potential cancers. You don't want that to be a death sentence. And it doesn't have to be because early detection, get your screenings, go to the doctor's office every year. And Mobile A will be right there in your community. So come see us and get your screenings done.
Well, I tell you, I have health insurance and I make sure to go and get my checkup. I remember years ago, I was having problems with my digestive system. And some people saying, don't worry to pass away. I said, no, I'm going to the doctor. I got insurance and I'm going. And I got diagnosed with ulcerative colitis. And I'm glad that I did because they went through a treatment process. I had some other complications and things. I'm still here some 20 years later. It really battled with me, but I know for a fact, if I had not gone to the doctor and got it diagnosed early, it would have been far worse. So I'm thankful that. And men, now I know one of the main thing that men don't want to do is get that prostate exam. That's a big issue. So my prayers are for you on getting that one done. We're gonna move on. Y'all know where I'm at on that one. All right. I like this thing here about your Wi-Fi. Okay, so tell us how you working with the Wi-Fi and this telemedicine piece.
Okay.
How does that work for us?
Okay, this is an excellent service. I mean, hands down, one of the best things I'm really excited about. Our mobile clinic actually will serve as a hotspot Wi-Fi, so you can drive up in the parking lot and use our Wi-Fi access. And this will also help you to have your telehealth services. Dr. Miner, as you mentioned earlier, with the depression and everything that's going on with COVID, and then mental health, just as a general status here in the United States, we're seeing more and more mental health, and they're needing their virtual visits with their providers. So we will hand them materials if they don't have it, meaning a tablet, and also the Wi-Fi, so they can have those virtual meetings with their provider. And so I'm excited that Plan A is offering this service. Also, we will be able to have you do a live if we need to assist with one of our providers to get on the call, the virtual meeting with you. We can do that as well. So again, this is very free, free, as Juliet said. You can have your hotspot, because we know in rural areas, we do not have the infrastructure, good internet. And I'm in Batesville, Mississippi, supposed to be in town, and I have a lot of internet issues. So this is going to be an excellent way to get your Wi-Fi, your internet, as well as those tablets, so that you can conduct your virtual meetings with the providers that you already have. And again, like I said, a lot of the mental health services are having telemedicine visits, but if you don't have the internet access, then you can't have your visit. And so we're excited for that, and please take advantage of that.
All right, and I'm glad you brought that up. What we discovered in one of our vice presidents for our state convention, Mid South Churches, he's there in the Delta. So what we did, we just decided to set him up for digital hotspot, virtual hotspot there in Sledge. Worked with Comcast and got it set up, and so the kids come out to the parking lot and other things. And I just had no idea. I'm up here in the Memphis area, things are a whole lot better. And everybody says, go on the web, go sign in. Well, if you don't have internet access, it's kind of a most difficult thing. All right, so that's wonderful. So everybody, you may kind of learn some things that when you may have an option of doing telehealth with your medical professional, you can coordinate here with Plan A and make that happen. That sounds like a good thing. All right. Let's drill down a little more on these referrals. I see here you have all kinds of referrals. Can we get a little bit more details? What I'm seeing here is not just referrals for people that have other health conditions. There are some things they're dealing with health and wellness. So would you tell either one of you all can share about the different types of referrals that you all would make available?
Okay, and thank you so much for that question. We do want to talk about the referrals. What we do is with the referrals, our clinic, as we stated, is a mobile community health clinic. And so we are not a permanent healthcare provider for you. And so the referral, we will come back. Let me go back to that again. We will come back the next month to circle around to check on those particular patients. But once we identify patients that do not have a clinic home, no provider, has never seen anybody. Also, when we identify those patients that need further services for high blood pressure, high blood sugars, we'll refer them to a brick and mortar clinic that is close to them that also meets their particular needs. And again, Plan A is not meant to be your permanent home, because we are a mobile clinic and we offer excellent services. But for those patients that need continued personal care, they will be referred to brick and mortar clinics that are close to them, as well as meet the particular needs as well.
Okay. All right, excellent. Okay, and somebody on here said they couldn't last more than about 10 minutes in talking, and we're at about 20 minutes of the hour. Okay, so is there anything else before we go to our last update and then go to Q&A? So Tori, Juliet, is there anything else that I missed that you want to share before we end this segment?
I'll defer to Juliet first, and then I'll come in last.
Yeah, just one thing. I know we are serving uninsured, but if you do have insurance, you still can come to Mobile A. Now, you can file it on your insurance, but we would not take any money from anyone for any services.
Okay.
So
All right.
if you are insured, you can still come.
Okay. So y'all hear that? So those people that have insurance and you can't get there to your health professional, they're more than willing to able to take care of you. That's a good thing. Okay. All right. So Tori.
Yeah. And one more thing, Dr. Minor, because Mississippi Delta is so rich with history and scenic pictures and beautiful, Plan A is offering a photo contest.
Oh.
The Mississippi Delta. We are going to, in our mobile clinic, we are going to put those pictures up so people can see how beautiful the Mississippi Delta is. If you go on planahealth.org/photos, you can find out all the information about it. And I believe the deadline is March 30th, but it is open right now for people to take photos of scenery or people or whatever you feel is the Mississippi Delta, is Mississippi.
All right. Wonderful. All right. So get the photo contest go there, and Duke's gonna type that in the chat, and we'll also share that on our Healthy Kids Mississippi Facebook page. So give us that web address one more time, Miss Juliet.
Yes, planahealth.org/photo.
All right. And look, you know, we lost Toria because the internet, I saw her freezing up. I was hoping she was gonna make it. And we thought Juliet wasn't gonna make it because she has the bars and she's coming on through. So we're gonna allow Toria just to get a second. She's coming, logging on the technology. And look, what y'all to know, even when we got this pandemic, we still will be doing these webinars because people have gotten used to bring this good information. Okay, so here we go. All right, so Tori, you got back on just in time to give us anything else to close out here. Unmute your mic there. Okay. All right, we want to hear you and see you. All right.
Yeah, looks like my internet went out. So look, so that's what I would end on. I need to Plan A community health clinic right now. So again, you know, services are free. Do know that you can do your telehealth visits with your provider. And so we just look forward to April seeing you and near your town.
All right. Again, everybody. Let's give a great shout out. Hold on, let me get Tori up. All right, here we go. We get that feedback. Let's go. Great shout out. Great shout out to Tori and Juliet for joining us today. We're gonna just we'll come back in a minute and bring it back up for any other questions that people have. Let me just spotlight myself here. And we're going to just have some updates on our health insurance. The updates that we have, just another reminder for healthy kids. Enrollment in Medicaid and the Children's Health Insurance Program is year-round. Enroll 365. Look, if you need health insurance for you or your family, let Healthy Kids Mississippi help you get covered. Also, we have some people that have need some assistance in getting renewed. We can do that as well. So give us a call at 662-298-3584, or you can email us at info@healthykidsms.org. We want to make sure that you are covered. Also, we just heard that beginning April 1st, because of the American Rescue Plan that was passed into law by Congress and signed into law by President Biden, that people who are covered under the Affordable Care Act, also known as Obamacare, may be eligible for increased subsidies. This includes people who enrolled last year between November 1st and December 15th, and those who already enrolled during this special enrollment period that began on February 15th. So after April 1st, you go to healthcare.gov, check on that, or give us a call also. We do have navigators who can assist you, 662-298-3584. There may be some people who just missed out on getting that subsidy to make their insurance more affordable. Well, this may be your opportunity. So give us a call and we'll follow up with you on that. Those are our updates. But the bottom line is we're here to help you to get covered. All right, we have about 12 minutes before we get to the top of the hour. We want to see if there are any other questions that we have. Let me go around the horn. I think the thing is that way we anticipated the questions and everything else. Okay, I think this is coming in. Let me bring up our team again. We'll bring everybody up. This question just want to come in to say, is there going to, okay, let me add spotlight. There we go. Is there any possibility, any timeline, is the possibility that you expand out of the counties that you have now? That's a question that's come up.
There is no timeline. If you have a particular area and you want to discuss it, we'll be more than happy to discuss and add that particular area, to our targeted list.
All right, and also, okay. There also the churches. So churches getting ready to go back to face. Is there any possibility of having the mobile unit to come up after service sometime for some of the churches on a Sunday? Would that be a possibility?
Yes, it will. Yes, we're willing to work. We're coming to you. We're willing to work with anybody who wants to take advantage of Plan A services.
Okay. All right. So is there a phone number that you have? A lot of people phone oriented, even though we got this website and everything else. Is there a phone number that they can call? All right,
so Tori. Tori.
Oh, I was muted. I'm sorry. The host muted me, Dr. Minor.
I did. I didn't. Not this time.
Not this time. Yeah. Actually, for the phone number, you can go to our website at planahealth.org, and there will be a phone number there for you to call. Also, check out our newsletter as well.
All right. So go there, Plan A, Plan A Healthcare, and you get the phone number. All right. I think that does it about our questions. We're looking across, looking at YouTube pages. Okay, so we're good. All right, so let me wrap this up again, ladies. Thank you all, but hang tight because we already have a wind down, and we'll do a post session a discussion. All right.
Thank you for having us.
All right, you're welcome. You're welcome. All right, so let me now I am muting. Okay, all right. So we're wrapping up today's session. They were laughing at me. They said there was no way we're going to make it up to this hour, but we thank you all for your questions. Some of y'all have asked questions even before we have the session, and we do our best to be able to address them here. So we hope that you will have been benefited from what we shared on today. If you joined us late, of course, you know that you can watch it in its entirety. It will be posted on our Healthy Kids Mississippi Facebook page and our YouTube page. We're also going to edit it so that we can add resources. We'll put some more web addresses and other information. And feel free to share this in your networks and with others and the information that they're sharing on today. Again, we thank you for joining us for this third Wednesday Parent Resource Chat. We hope to see you on Wednesday, April 21st. That'll be our next session. We'll be posting information in our social media, across social media, letting you know our next topics. And just once again, we remind you that if you need health insurance for you or your family, let us help you get covered. Give us a call today. Healthy Kids Mississippi, 662-298-3584. Once again, my name is Michael Minor, and I am the Executive Director of Oak Hill Regional Community Development Corporation, located in Hernando, Mississippi. And we thank you on behalf of our project director, Lottie Minor, and our board chair, Jennifer Garrett. So until we meet you virtually next month, we hope that y'all will have a wonderful rest of your day and in the upcoming weeks. Stay safe. God bless. This concludes the social media part of our broadcast, and we thank you for joining us today.